Hello, this is Dr. Kathy Pratt. I'm the director of the Indiana Resource Center for Autism at Indiana University, and I'm also a board certified behavior analyst. And I'm going to be talking to you today about behavior. This summer, the Indiana Resource Center for Autism staff and our autism leaders and others are presenting parent Zooms for free, just to help you during this difficult time. And so hopefully you'll get a few tips today from us. If not, please visit our Facebook page and our website, and you're also welcome to email me at any time with questions. So tip one, know that there's not a categorical approach that says child has these disabilities, and whatever it is on the autism spectrum, anxiety, ADHD, and they have this behavior and this is what you do. There's really not a recipe for behavior. And in truth, we have to get to know each individual and each situation. And so when I go in and do behavioral assessments, when I see children with behavior, I have to know the individual, their strengths, their skills, their challenges, their interests, their context. I have to know everything that's going on, and also for us to understand that we are part of this equation as well. So I have to look at the interaction with the professionals, the family members, and the individual themselves. Behavior is a dance, and we're engaged in that dance as well. So the question that we oftentimes get is, what do we do when? What do we do when a child is hitting or kicking or putting their head down, refusing to do things, or screaming? What do we do when? And there's a few things that question prompts for me. One is that I know that there's always more going on than what that initial question tells me. And so again, I have to go and see what really is going on with that child. The other thing is that when I get asked that question, I know oftentimes that means that family members or professionals are in crisis with the child. And that means that the child is in danger of hurting themselves or hurting other people or doing property damage. So crisis management, if the only way that you interact with behavior is when behavior is happening in the heat of the moment, understand that that is only a short-term solution to a problem behavior. And it really doesn't equate to long-term behavior change. What we know is that the only way to change behavior in the long term is to teach a child a different way of behaving, to teach an alternative skill. So I would also encourage that if you put together a crisis plan, that it needs to be written down. And part of the reason for that is that I know that oftentimes when plans have been developed, they don't work because they're not followed. So, the people in the household need to have some consensus about how do we respond when this behavior happens. And there has to be some consensus in terms of that response, because otherwise the child is getting mixed messages about what's going to happen, and that's never a good thing. And then know the signs that a behavior is escalating. I know as a teacher, oftentimes I could tell that my students were starting to verbalize a little bit more. They may be paced. Sometimes their facial expressions changed. Sometimes the coloring changed. Sometimes they did more self-stimulatory behaviors. So understands those signs when the behavior is starting to escalate. So understand that when we interact with behavior, anytime we interact around behavior, we run the risk of strengthening or reinforcing the negative behavior. So this is a scene that I've seen played out many times. A child who loves attention and runs out of a house or out of a building, and people chase after them. And they're kind of excited by that. And so that actually strengthens or reinforces the negative behavior, and it'll be harder to suppress it in the long term. The main thing is that when a child is acting out, and this is really hard, is that you have to maintain your calm. You have to stay very neutral. You have to not show what your emotional reaction is. Because as soon as you respond, as soon as you react, as soon as you kind of engage that child in a negative way around the behavior, you've told the child what your hot buttons are. And they're going to probably push those hot buttons in the future. So maintain your calm. I think the other way to look at it is that for our children who have this neurological disorder and have sensory processing challenges and other things going on, for us to not remain calm only throws them and triggers them into more behavior. So stay as calm as possible. Again, have a plan, don't yell or threaten. Empty threats, if you do use the empty threats, if you do that one more time, you're going to go to your room. If you do that one more time, you're going to go to your room. What a child learns is how many times they can get away with something before you actually carry it out. So be careful about empty threats. And again, this is really counterintuitive, but the worst time, the least effective time to address behavior is when you're in the heat of the moment. When the behavior is escalating, at that moment, your only goal is to de-escalate the child. It's not to teach the child a different way of responding. It's not to teach them a lesson. It really is to kind of minimize the situation and get everybody to a state of calm. And then choose your battles. Know what your hot buttons are, what triggers you. For example, I have a hard time with whining behavior. Whining behavior is a challenge for me. And so now that's not an extreme behavior, but I know that that's a hot button for me. And so I kind of joke with my grandkids and with my family members that, that whining is not a good behavior to use around me. So understand what triggers you. What are the things that challenge you a little bit as well? So behavior is typically an indicator of other things in a person's life, and it may be an indicator of all sorts of things. And so we have this process called functional behavioral assessment that we use in schools. And so I kind of think about it in terms of a medical diagnosis. So if an individual goes to the doctor and they have all kinds of symptoms, losing weight, chronic headaches, whatever those symptoms are, and they go to the doctor and the doctor only treats the symptoms and doesn't look for the underlying cause of those symptoms, that disease will never go away. And I think too often we treat the symptoms of a behavior and we don't really look at the underlying conditions. What is the why? Why is the child doing this? Coming to some understanding about what's really going on in that child's life. And I'm not going to lie to you, sometimes it's a very difficult process. So in that behavioral assessment process, we know that there's two different kinds of antecedents. And for children on the spectrum, we see triggers, slow triggers or setting events are often the antecedents that are the most important to understand. So let me explain it this way. When we look at behavior, we look at behavior in terms of what comes before the behavior and what comes after. And so we have kind of two categories of antecedents. One is the setting events, and the other one are the immediate antecedents. So the setting events are things that you may or may not see, but that increase the likelihood that a behavior will occur. So for example, you get up in the morning and you've got a busy day ahead, and you go to get dressed, and the clothes that you were planning to wear are at the dry cleaners. And then you go to get a cup of coffee and there's no coffee in the house. And then you go in to get into your car to go to work, and your gas tank is on empty because a family member used the car and forgot to fill up the gas. By the time that you get to work and all these things have happened in the morning, you may be a little bit more agitated. So for our folks on the spectrum, understand that there's things in their life that are setting them up for having behavior difficulties. We know that anxiety is major for our kids, and with anxiety goes depression. We also know that there's biological issues, and when I'm looking at a child, I will look to ask about the health, and because we know that many of our kids have gastrointestinal issues, we know that they may have allergies or asthma or seizures, and so we have to understand kind of the biological things that are going on with an individual. We also know that schedule and staff changes can have an impact, and all the schedule changes that children have been through this year have been really tough for them and for you as well. Medications, they're changed or missed. I'm not a physician, so I'm not going to recommend a medication, but I know that medicating a child is more of an art form than a science, and finding psychiatrists who have a good understanding of children on the autism spectrum is really rare. And fortunately, we do have some good psychiatrists in the state, and so, but more is not always better, and it's important that you understand how the dosing is done and the consistency in dosing. Irregular sleep patterns, many of our kids have difficulties with sleep, and if they don't sleep at night, they may be more challenged the next day. We also know that illness or an impending illness, so often as a teacher, I would have a child who would act out, and then a couple days later would become ill. Missed meals can be setting events, excessive hot and cold temperatures, because we know that our children with these sensory issues don't process temperatures the same way that others do. Arguments or fights with classmates, parents, teachers, siblings are all setting events for these kids. When they ride the bus, when they go to school, if there's difficulties on the bus, skill deficits. And the skill deficits are the ones that we're going to talk about a little bit more. And that to me is the most important one. There is this fabulous professional, Ross Greene, who has the saying, if they knew better, they would do better. And I think, again, for our kids, oftentimes behaviors are really related to those skill deficits. A lack of communication system. You know, our individuals need to have a way of telling us what they're thinking and feeling. Sensory issues are a setting event. Trauma in a child's life can be a setting event. And so these things set them up for having more challenges and difficulties. So consequences, I think, you know, it's important to understand consequences from the perspective of the individual. And again, to realize that we may intentionally or unintentionally reinforce behavior. I know, working with students through the years, I've worked with individuals who engage in self-injurious behavior, and found out that the reason that they engaged in self-injurious behavior was that it was fulfilling a sensory need for them. It doesn't make sense to me, but from their perspective, they were getting a need met. And so in that individual's programming, in previous years, when people were restraining them, they were giving them sensory input. And so that was only reinforcing and increasing the behavior. So you have to look at it from the individual's perspective. What is the payoff? What are they getting from this behavior? People continue doing behavior because they get something from it. There's a payoff from it. So behavior support plans should kind of logically evolve from the hypotheses we develop, and I encourage you to work with your school team on that. But I just want to show you kind of a grid that I use oftentimes when I'm looking at behavior. Because I go into schools and I hear about behaviors, and people will tell me all kinds of things that are going on. And so this is a very simplified version. This was a student who would yell and publicly chastise other students. She would see students who were violating rules in the school. She had some biological problems. She had some gastrointestinal difficulties. She had anxiety, and she had depression. She also had social skills deficits. And so when she would see students violating rules, she would have these behaviors. And what she got out of it was a small release of kind of tension and anxiety. She got some staff attention, and she got the students to get away from her. So the question that was given to me is, what is the consequence? What is the punishment that we deliver to make sure this child quits doing this? But understand that this child does not have the social skills to be able to know how to interact with kids in an appropriate fashion. And punishing her, telling her no, being punitive with her is not going to give her those skills. So we also want to make sure, again, that we are very specific about what the alternative behavior is. And the idea is that you have to make that alternative behavior as efficient and as effective as the problem behavior is. So for example, if you know that your child uses their behavior to communicate stuff to you, they will need a communication system, but then we need to listen to that communication system and use it, you know? So think about and this is a challenge as you're working with other professionals, you should always be thinking about, what do you want your child to do instead? So these are just some of the alternative skills that we know that many of our students on the spectrum are challenged by. Problem-solving skills, choice-making skills, anger control, relaxation training, self-management and control, communication. Let me just say something about communication. If I were the parent of a child with autism and my child had speech therapy for 30 minutes a day, once a week, I would be furious. If they had speech therapy for 30 minutes twice a week, I would be angry. If they had speech therapy for 30 minutes, 5 days a week, I would be still livid. Because really a good communication program is not solely about the individual having speech therapy services through an SLP. What it is how does everybody use that communication system? So we ask the wrong question. We ask the question is, how many minutes of speech therapy does my child get a week? Instead, we should be asking, how does my child communicate at all times? We think about social skills. We know that if individuals are going to be successful in the long run, that we really have to look at the importance of resilience. And resilience is very critical for our individuals. And it kind of means that sometimes we have to push our folks to a little bit of discomfort And, you know, people build resilience through failure. And I know that that's really hard, but sometimes we protect our individuals so much that we don't set them up for adult life. And then self-regulation. So know what to do, tip 9, and support, but do not overly support. So, so we look at in autism, we talk about kind of this dichotomy between accommodation and assimilation. And so there are those who believe that our job is just to accept the person's autism and to accommodate them in every way, in every shape and form. And then there are those on the other side who believe that the person with autism needs to just be act like everybody else and be as normal as possible and get rid of those autism behaviors. And the reality of it is that individuals on the spectrum, like all of us, are somewhere in the middle of accommodation and assimilation. But what I do know is that if we accommodate too much, we will accommodate people right out of possibilities in the future. So again, creating that discomfort sometimes, kids need to understand they're not always going to be first in line. They're not always going to win the games. And again, these are going to be individual choices that you make. And I know that family members, you need to choose your battles. But my goal is that your child is ready for life. And we know that the unemployment rate is very high for our individuals on the spectrum. So as much as we can do to kind of set the individual up for more success, I think is important. I think also engaging the individual in meaningful and motivating activities. Our folks tell us a lot of times what motivates them. It's their fascinations or their fixations. But individuals are going to be more willing to be engaged in things if they find it meaningful to them. Know how your child learns. You know, many of our kids are visual learners. Or does your child learn best by being shown something? Do they learn best by being actually physically assisted in doing something? So know how your child learns the very best way. And then build in choice. And there's a lot of literature that says that when children are given choices, that participation increases and behavior goes down. So not everything is a choice. It's not a choice about whether you go to bed or not, but it is a choice about what kind of pajamas you wear, whether there's a light on or not, if somebody reads to you. So think about how you build in little choices, and teaching children what are choices and what are not choices is also a really good skill. I think just being present, spending time with your child is a really great strategy. And then I think we have to address the sensory needs, with our individuals, and having fidgets and other things around for the child, and hopefully working with an occupational therapist who understands some things about sensory. And then for some of our individuals, having a safe area in the house or a calming area so they know when they get overwhelmed that there's a place that they can go to be safe. We look at task analysis as a strategy, and the reason that I bring up task analysis is to understand that when we do something in life, it seems like a seamless activity and is oftentimes very simple. But oftentimes for our individuals who are on the autism spectrum, what you will see are things that you and I perceive to be very simple from their perspective is challenging. And we have to know and teach every step that's involved with that oftentimes. So understand what's part of any routine that you're doing. We use a lot of visual supports with our folks, and the Indiana Resource Center for Autism has a full catalog of visual supports for free. We have them on Pinterest as well. So know what visual supports work for your child. I think for your child to understand rules, having routines during the day, making sure that they understand the expectations, and again, working with people in the household to kind of develop those routines and expectations. Having a calm, safe, and predictable environment, again, with our individuals who are having this neurological disorder that oftentimes makes the world overwhelming, having a calm, safe, and predictable environment will help to calm them as well. We also know that brain intervals, what we call brain intervals or building and movement into the day, is critical for our folks, making sure that they're getting up and they're moving around, building in some reinforcement for them. And, for example, if you do this, then you can have access to this. But again, things that we know are really reinforcement builders for them. And then I think, if I think about the strategy that is the most important in terms of working with children on the autism spectrum, I think rapport is critical. If the child trusts you, and if you've built a relationship, you've spent time really building that relationship with them, they will do more for you, And, learning, doing things differently is scary, and if you don't trust the people who are guiding you on this journey, then it's not going to be as effective. So building that trust and really spending time with the individual and establishing that rapport and finding out what interests them is going to be really critical. I think the other thing is that I realized that living with a child on the autism spectrum, and I'm sure especially during this time, can be very challenging for all of you as well. And so I'm going to also really encourage you to practice some self-care. And I know that that seems impossible at times, but it's kind of like that analogy about being on an airplane, and if the airplane goes down, you have to put the mask on yourself first before you put it on your child. And I'm asking you, please put the mask on yourself first, you know. So exercise when you can, you know, eating habits have an impact. Meditating or just having some quiet moments can be really helpful. I know in these days, I'm really reducing access to news to kind of keep myself out of what's going on and calmer about all of this. Connecting socially with family and friends, and even if it's via Zoom or wherever, and know where your support comes from. And I know that I've worked in this field for many years, and I know from many families that autism becomes a very isolating disability for the family. Know that there's support out there. Get connected. We have a lot of parent support groups in the state of Indiana. Be around positive people. You know, laughter is a great medicine. As a teacher, I was very blessed that I got along very well with the parents of my students and was very involved with the Autism Society. And in those meetings, we would go get together, and I have to tell you, we would just laugh and tell stories, and it was so medicinal for us. It was great. And then I think also in all of this is establishing routines and setting goals for yourself is going to be really important. So we're here for you. Feel free to reach out to the Indiana Resource Center for Autism. We know these are difficult times, but we really want to help. Thank you for your time.